So endocrinology is the study of the body's hormones, and hormones can be likened to chemical letters that circulate around the body in the bloodstream. And letters come from a post office, and that post office is deep in the middle of the brain. And if you can see this tiny little gland here, right in the middle of the brain, is called the pituitary gland. It receives messages from above in the hypothalamus. And this is a larger diagram. And the pituitary itself is split into two halves, a front part and a back part. And from the back part of the gland, you'll see that there are messages that control our water balance and our thirst. That's a very vital function, and the amount we drink. From the front of the gland are messages that control our growth, that tell us when to go into puberty, functions that we take for granted, our fertility, and very important messages for stress itself, the cortisol function, which is our fight-flight response and is the reason why we get jet-lagged. And of course also the thyroid gland, which is important for metabolism. So the pituitary gland is responsible for controlling vital functions that we take for granted. And together with the hypothalamus, it constitutes the most important endocrine organ and is the master gland, and is responsible for many conditions that we take for granted and in controlling a lot of the functions of the target glands in the body. So the pituitary gland may be malformed from birth. Embryologically, it develops as an outpouch from the mouth and grows upwards, and it actually sits outside the brain, and you can reach it through the nose surgically, and is connected up to the brain through the pituitary stalk. Sometimes if the brain area doesn't develop properly, you can see from where it is positioned in the brain that it may be very close to the optic pathways and the hypothalamus. And if the babies are born without development in this area, it may include blindness as well as hormone deficiencies and a hypothalamic disorder, which may include weight loss or weight gain and early and dysfunctional puberty. The other reason why the pituitary may be malfunctioning is because of pituitary tumours that either grow in the pituitary itself, such as a pituitary adenoma, which may be non-functioning or can sometimes also produce hormones of its own. There may be other non-functioning adenomas or craniopharyngiomas that arise in the pituitary, and more malignant tumours that occur in the pituitary stalk. And also tumours of the optic pathway can grow down and compress the pituitary. And any tumour, or indeed the treatment for that tumour in that area, can cause the pituitary to malfunction. It's important to have just the right amount of a hormone, not too much and not too little. And as I said, there are tumours like pituitary tumours that can make too much, but of one particular hormone, squashing out the others, but there are also other tumours that grow down into the pituitary. The symptoms of a malfunctioning pituitary depend on the cause. So for example, if you have a tumour that's making too much hormone, you will get symptoms of that. So you might grow too fast if you have too much growth hormone, or you might get very heavy if you have too much cortisol. And if at the same time that expansion of the tumour or the malfunction of the pituitary includes deficiency, then you will grow less well, you may not develop in puberty, and you may not develop fertility in the future. If you are an older child, your physical development may begin and then arrest, and you may need help to complete it. And if you have malfunction of the back of the pituitary gland, you may get very, very thirsty and drink lots and lots of water, and pass lots of urine. Something that's reminiscent of sugar diabetes, and that's why it's called diabetes, but it's diabetes insipidus, because the urine is very clear and dilute, because what you're lacking is the hormone that allows you to concentrate water and retain water. And that is also a very potentially life-threatening situation and may herald some disorders of the pituitary, posterior pituitary gland, or some particular tumours affecting that area. And it's an important condition that is not always well recognised, and one that's not important not to miss. And obviously, if you erode a lot of the hormones in the pituitary and are deficient of all the hormones, something that we call pan-hypopituitarism, that can creep up on you, but you are at potential life-threatening risk when there is an intercurrent illness or a crisis, or if you're knocked down by a bus. These are potentially life-threatening deficiencies. So if we go back to the post office idea, you can see that the pituitary gland produces a number of different messages for each hormone, for each target gland. And then in response, the target gland has to produce a response. So if we take a common problem like thyroid dysfunction, here is the thyroid stimulating, or TSH, message to the thyroid gland. If the thyroid gland is not working, you won't produce thyroid hormone or thyroxine. If the pituitary isn't working, you won't produce thyroxine either. But you can differentiate between the two, because in this case, if the pituitary is working and the thyroid gland is not working, the pituitary will push more and more TSH, thyroid stimulating hormone, and that is high. A bit like trying to push on a blocked sink. You will put lots more water in to try and make the thyroid gland respond. And that's the most common form of underactive thyroid hypothyroidism. However, if the pituitary isn't working, the TSH will be low, and so will the thyroxine. So then you can differentiate whether the problem is here or the problem is in the pituitary. And the same is true with fertility. If the problem is in the ovary or the testis, you will get very high messages of LH and FSH, with the pituitary trying to drive the organs to produce their relative hormone responses. If the pituitary isn't working, these messages, as well as the estrogen and testosterone, female and male hormones respectively, will be low. The treatment of a deficiency is replacement therapy. And we have all the hormones, we can replace them. Most of them by tablets, but some require injections, for example, growth hormone. So actually replacement therapy for an endocrinologist is very rewarding, because we are replacing normality. And there should be absolutely no side effects of our treatment. We should aim to give the right amount in the most natural form. And for example, female hormone replacement therapy can be given in a gradually increasing dose to induce puberty in a girl, and we can give it in very natural ways with natural hormones and even through transdermal preparations. So we have very physiological ways of replacing that do not cause any side effects for all these hormones, including growth hormone, female hormone, male hormone, replacing antidiuretic hormone, and it's a very rewarding treatment that we can give.